So let's move to the physiological effects of labor on the fetus. A is molding. The physiological gradual overlapping of the vote bones as the skull is compressed during its passage in the birth canal. One parietal lobe overlaps the other, and both overlap the occipital and frontal bones, so fontanelles are no more detectable. It is of a good value in reducing the skull diameter, but severe and or rapid molding is dangerous as it may cause intracranial hemorrhage. So here there's actually a physiological compression of the bones of the skull of the fetus. This is actually to reduce the diameter of the head. But when this is overdone or it is severe or rapid, it may cause hemorrhage, and it's intracranial hemorrhage to be specific. That's bleeding within the brain. So let's look at the degree of molding you can have. 1 plus, which is suture lines close but no overlap. So here the compression just closes the suture lines. We have 2 pluses. Here the overlap of the bones but reducible. So here there is overlap of the bones of the skull, but it can go back to its usual nature after birth. We have 3 pluses. Here is overlap of the bones but irreducible. So here there's an extreme overlap of these bones in such a way that even after delivery they do not return to their normal position. You should also know that the term reducible here means that the bones of the skull can be pushed or manipulated either by the doctor, the midwife, or anyone who knows how to do it to return them back to their normal position after there is molding. So another effect of labor on the fetus is caput suicidum. It is a soft swelling of the most dependent part of the fetal head. It occurs in prolonged labor, before cervical dilatation, and after rupture of the membranes. It is due to obstruction of the venous return from the lower parts of the scalp by the cervical ring. Large caput may obscure the sutures and fontanelles, making identification of their position difficult. This can be overcome by palpation of the ear. It can also give an impression that the head is lower than the true level. So in a nutshell, caput suicidum is the soft swelling that appears on a newborn baby's head right after birth. It happens because the baby's scalp was pressed against the mother's cervix or birth canal during labor. During labor, the baby's head is squeezed tightly as it passes through the cervix and vagina. This pressure causes fluid, also known as serum, to build up under the scalp skin. The result is a soft, puffy swelling on the part of the head that presented first, which is usually the vertex. There is an artificial caput suicidum known as chignon. It is induced during vacuum extraction. Caput suicidum disappears spontaneously within hours to days of birth, as it is a vital manifestation, so it is not detected in intrauterine fetal death. The presence of caput indicates that the fetus was living during labor. Labor was prolonged and difficult. The attitude of fetal head during labor can be expected as caput is present in the most dependent part of it.